My name is Betty Njoroge from KEMRI, Kenya, and I'm presenting on young people and HPV, what is working and what is missing. So as an introduction, the human papillomavirus HPV infection can cause 6 types of anogenital, oropharyngeal, and head and neck cancers. The HPV virus is also responsible for genital warts, and we now have HPV vaccines that are available that have the potential to reduce the incidence of cervical and other anogenital cancers, as well as genital warts. HPV peak infection is seen during adolescence, in early adulthood, and it has been seen that 74% of HPV infections occur in the 15 to 24-year-old age group. It's also been noted that there are knowledge gaps among youth on HPV infection and HPV prevention. And as we know, both girls and boys are affected. So it is critical for us to have youth-focused HPV prevention in place. This is just a diagram, a cartoon that shows that HPV does cause 6 types of cancers, and the cartoon shows where the cancers occur, and it's mainly cervical cancer, which is the most common cancer that we know about, that's caused by HPV vaccine, anal cancer, oropharyngeal cancer, penile cancer, vaginal and vulvar cancer. So when we look at the HPV vaccine national immunization programs globally, we can see that quite a number of countries have introduced HPV in their national immunization countries. We have 194 countries that are currently running a HPV vaccine program, but we can also see that also quite a number of countries have either partially introduced HPV vaccine in the national immunization program, and the other countries that have not, or as we can see by the WHO chart, data is not available. So when we think of HPV prevention, we have 3 types of prevention. We have what we call primary prevention, which is mainly achieved by vaccination. Secondary prevention, which is achieved by screening women and treating of precancerous lesions. And then we have tertiary prevention for cervical cancer, where it consists of treatment of invasive cancer and palliative treatment. So for primary HPV prevention, the WHO has targeted that 90% of girls should be fully vaccinated by the age of 15 by the year 2030. And we have seen that in sub-Saharan Africa, the coverage still remains low, with less than 20% achievement. We do have case studies like Rwanda, which is a success story, and it has achieved more than 90% coverage of HPV vaccination. More than 30 countries in sub-Saharan Africa have introduced HPV in their national vaccine program, and this is quite commendable. And most of this is achieved by Gavi support, which is critical for low-income countries. So as we can see, we have a dodo here, and the achievement of HPV vaccine in Africa is still slow. So what's missing when we look at HPV vaccine? We see that in sub-Saharan Africa, we have a low vaccine coverage, and this is mainly due to mixed doses, due to school absenteeism, and during the COVID pandemic, Those are disruption in the national vaccine programs. We've also seen that there are supply chain and cold stage challenges. Most of the programs do not target boys. And when we look at the services that are offered, we see there's a lack of youth-friendly services. And as noted, there's limited involvement of young men in awareness for HPV prevention. We also have cultural barriers and stigmas and misinformation, where some groups feel that when we say that we want to vaccinate the youth and young girls against HPV infection, that we are encouraging them towards sexual promiscuity. And then also the cost of the vaccination, which is quite expensive. So we have weak financing again with certain governments, and there's over-reliance on donor funds. What do we need in order to achieve proper HPV vaccine coverage? Youth-led campaigns are required. We need to involve the youth. We need to look at social media and see how we can attract the youth, have them more aware, create peer networks that will improve HPV knowledge so that we can encourage HPV vaccination and also increase awareness. We also would need more NGO-driven awareness programs. This sometimes lacks due to funding that is required. And then we also require national HPV vaccine policies, which is present in more than 30 African countries in sub-Saharan region. We need to expand our vaccine supply via single-dose schedules. The WHO has now promoted the use of single-dose vaccination for HPV, and it has been shown to work. We have quite a number of countries that have introduced the single-dose vaccine schedules. The African Union also has a commitment to WHO elimination strategies. And then we have received donor support through Gavi, UNICEF, and the WHO. What are the challenges we have with service delivery? As noted, Africa has a population of more than 425 million women who are aged 15 years, around 15 years and older, and at the risk of developing cervical cancer. There's limited infrastructure for screening and vaccination. And when we look at the vaccines that are offered, we've seen that there are rural and urban disparities, with more vaccination programs occurring in the urban areas and challenges within the rural areas. There's a requirement for integration with HIV and reproductive health clinics. We have seen that in some countries, there's mandatory HPV vaccination for women attending HIV clinics. We also have challenges with mobile outreach and school-based programs. And this was seen during the COVID pandemic when schools were closed and the HPV vaccine programs were stopped. Then we have tax shifting to nurses and community health workers. We need to combine HPV vaccine with routine immunization in order to achieve good service delivery. So what is the target population for HPV vaccination in Africa? The target population would be the youth. In Africa, we have a youth bulge with more than 60% of the continent's population under 25. So it's very important to target this demographic group if we want to achieve elimination of cervical cancer. When we find that youth have missed HPV vaccine campaigns for school-based programs, we still need to target them by looking at how we can identify out-of-school going girls, look at the schools and girls that missed the HPV vaccine due to the slow COVID vaccine uptake, and also the slow uptake of HPV. We need to look at vaccine delivery strategies by targeting school-based programs and encourage clinic campaigns, health clinic campaigns, and target clinics like HIV care and comprehension that have good programs and are able to regularly see adolescent girls and youth that attend these clinics. And then when we have enhanced HPV vaccine coverage, we will achieve a population impact in that we'll have had protection. And we have seen that the HPV vaccine uptake is quite slow. So what's working towards HPV prevention? So we have Rwanda, that is a success story, and it has achieved a 90% HPV vaccine coverage by the year 2023. We have the introduction of the single-dose HPV vaccine programs. And as mentioned earlier, we have Gavi support in more than 30 African countries and integration of HPV vaccine in national programs. So when you look at Rwanda as a case study, in the year 2009, we saw it was the first African country to introduce a national HPV vaccine program. And then in 2011, they targeted 12-year-old girls with a Gardasil vaccine through a school-based delivery system. When the COVID pandemic came, later on, they also conducted a catch-up vaccine campaign where they targeted secondary school-going girls. So they had vaccinated the 12-year-old girls, and then later on, they went and targeted girls who are above 15 and were attending secondary schools. This program has been seen to consistently achieve high coverage rates, and with a first dose coverage of more than 90% by 2023. And it is now, then Rwanda is now focused on a national-wide vaccination and screening program to eliminate cervical cancer. So we've seen that the success of this program was attributed to strong stakeholder engagement. The government was quite invested in eliminating cervical cancer. On the ground, we see there's a culture of local accountability, effective resource mobilization, and support from international partners like Gavi and PATH. And this would be a good model for African countries that needs to come up with a targeted vaccine program for school-going children. And given that we have artificial intelligence that's really coming up, so how would AI play a role in HPV prevention? We've seen there are chatbots like the VaxBot HPV that is able to notify potential youth on vaccine appointments. It can also answer questions for individual users, and also that have questions about the vaccine. It is able to overcome misconceptions and provide evidence-based responses to increase vaccine confidence and promote informed decision-making. We've also seen that machine learning can help streamline the complex process of vaccine development, and by helping to select appropriate antigens. It can also design immunogens and predict epitopes and assess immunogenicity, which is important for vaccine development. And from the point of global health initiatives, AI can also provide solutions to public health challenges and can support global efforts to eliminate cervical cancer and promote equitable access to vaccination and HPV prevention. So what are the recommendations and what is the call to action? HPV prevention strategy for adolescents and youth is critical when we look at HPV vaccination. So it's important to note that for adolescents and youth, we do not screen against cervical cancer. The most important tool is HPV vaccination. We need to adopt single-dose HPV vaccination into national immunization schedules, improve communication and social mobilization for HPV vaccination. This will address vaccine hesitancy, look out for adverse events, and just general misinformation. We need to scale up our school-based vaccination programs and also introduce catch-up programs for girls who we missed, because right now we are targeting girls 9 to 12 years old, and we also need to have catch-up programs for girls above 15 years. We need to engage youth in the design for HPV vaccination and delivery of this service. It's known that one shot can prevent us from 6 types of cancer and anogenital warts. So it's really important to be vaccinated. And we need to know that a HPV-free Africa is within reach if we can center HPV prevention on our young women. Thank you very much.